Hey, future nurses! Professor Angoma here with Kingdom Healthcare, and we're back to help you conquer the NCLEX. Remember that feeling when you aced that anatomy test? That's the feeling we're going for, that I got this confidence. Today we're diving into part 2 of Mastering NCLEX, Next Gen Management of Care. This is where the NCLEX gets real, testing your ability to think critically and make sound judgments in complex patient care situations. But don't worry, I've got your back. We'll break down essential scenarios and questions, providing clear explanations and strategies to help you ace your exam. So grab your coffee notes and let's crush this. Alright, let's jump right into it with our first scenario. Imagine you're on your shift and a patient calls out requesting pain medication. What's your first move? Remember folks, pain is subjective. It's whatever the patient tells you it is.
Now, before you even think about grabbing that medication, you need to assess the patient's pain level. Ask them to describe it. Is it sharp, dull, throbbing? Where is it located? How long has it been going on? Don't just rely on their initial complaint. Dig a little deeper.
Next, check their vital signs. Is their blood pressure elevated? Are they tachycardic? These could be physiological responses to pain. Remember, unrelieved pain can have serious consequences, impacting their recovery and overall well-being.
Once you've assessed their pain, it's time to act. If their pain medication is due, administer it promptly. Don't delay their relief, and document everything. Your assessment, the patient's response to the medication, any changes in their condition.
Now let's say the patient's pain medication isn't due yet. What do? Well, you don't just leave them hanging. Explore non-pharmacological interventions. Could you reposition them for comfort, offer a warm compress? Sometimes simple measures like these can make a world of difference.
The key is to show empathy, address their concerns, and provide the best possible care.
Let's move on to a tougher scenario, one that tests your ethical boundaries. You walk into a patient's room and notice that the IV fluid is low, almost empty. You check the chart and see that it was supposed to be changed an hour ago. You ask the nurse assigned to the patient if they've changed the IV fluid, and they say yes, even documenting it in the patient's chart. However, you see the old, almost empty bag still hanging there. This raises a huge red flag. What's going on here?
It seems like the other nurse might have falsified documentation. This is a serious offense, a direct violation of the nursing code of ethics. It jeopardizes patient safety and can have severe consequences. So what do? This is where your integrity as a nurse is tested.
The first and most crucial step is to address the immediate situation. Change the IV fluid yourself, ensuring the patient's safety and well-being.
Next, you need to report the incident to your nurse manager immediately. This isn't about getting anyone in trouble. It's about accountability and patient safety. Falsifying documentation is never acceptable, and it needs to be addressed promptly.
Remember, as a nurse, you're an advocate for your patients. You have a duty to speak up when you see something wrong, even if it's uncomfortable. Your actions could potentially save a life. Alright, future nurses, let's talk about patient rights. Every patient has the fundamental right to refuse treatment, even if it's in their best interest. It's about autonomy and respecting their decisions.
Imagine you're about to perform a dressing change on a patient's surgical wound. You've gathered your supplies, explained the procedure, and you're ready to go. But just as you're about to start, the patient firmly refuses. Now, before you start questioning their judgment, take a deep breath and remember, it's their right.
Instead of getting frustrated, try to understand their perspective. Why are they refusing? Are they afraid it will hurt? Do they not understand the importance? Engage in open and empathetic communication.
Explain the importance of the dressing change, emphasizing the potential risks of infection if the wound isn't properly cared for. Answer any questions they might have, addressing their concerns with patience and understanding.
If they're still hesitant, don't force it. Document their refusal and inform the healthcare provider. You can always try again later. Sometimes a little time and a gentler approach can make all the difference.
Now, let's address a common pitfall in nursing labeling patients. It's easy to fall into the trap of judging patients based on their behavior or medical history, but it's crucial to avoid this at all costs.
Imagine you're on your shift, and you overhear another nurse saying, "The client in 212 is a drug seeker and keeps asking for pain medication." This statement should immediately raise red flags.
Why? Because it's judgmental and dismissive of the patient's pain. Remember, pain is subjective. Just because a patient has a history of substance abuse doesn't mean they're not experiencing real pain.
It's our duty as nurses to assess each patient individually and treat them with dignity and respect, regardless of their past. Instead of labeling patients, focus on objective assessments. Use pain scales, ask open-ended questions, and listen attentively to their descriptions.
If you have concerns about a patient's pain management, communicate them to the healthcare provider, but avoid making judgmental statements. Remember, every patient deserves compassionate and unbiased care.
Let's break the cycle of labeling and create a more empathetic and respectful healthcare environment. Let's talk about documentation, the unsung hero of nursing. It might seem tedious, but trust me, it's your best friend. Accurate and thorough documentation is crucial for communication, legal protection, and continuity of care.
Imagine you're administering medications, and a patient refuses their scheduled dose of metoprolol. What's the first rule? Document it. But not just a simple metoprolol not given. You need to be detailed and objective.
Here's what a good documentation entry would look like. Metoprolol, 25 mg PO due at 0900, not given due to patient refusal. Patient states, I don't want to take that medication today. Provider notified, and client education provided on the risks of missing a dose.
See the difference? It's clear, concise, and includes all the essential information: the medication, dosage, reason for not giving, patient statement, and your actions. This level of detail is crucial for legal protection and ensures everyone on the healthcare team is on the same page.
Remember, if it's not documented, it didn't happen. So be diligent, be accurate, and make documentation your best friend. Let's face it, nursing is a tough job, and we all need to support each other. Unfortunately, workplace bullying can be a reality in some settings, and it's crucial to address it head-on.
Imagine you witness a colleague constantly belittling another nurse, making sarcastic remarks, and undermining their confidence. This behavior is unacceptable and creates a toxic work environment. What can you do? First, support your colleague who's being bullied. Let them know you're there for them and that their feelings are valid.
Encourage them to report the behavior to the nurse manager. If you feel comfortable, you can also address the bully directly. Sometimes people are unaware of how their behavior affects others. A simple, hey, that comment was inappropriate and hurtful, can make a difference.
Remember, a positive work environment is essential for providing quality patient care. By addressing bullying head-on, we create a more respectful and supportive workplace for everyone.
As nurses, we're patient advocates, always putting their needs first. A crucial part of this is respecting their right to withdraw consent at any time.
Imagine a patient who initially consented to a surgical procedure, but has now changed their mind. They're feeling anxious and unsure, and they've decided they don't want to go through with it. What's your role? First and foremost, listen to the patient without judgment. Validate their feelings and reassure them that it's okay to change their mind. Their autonomy and right to make decisions about their body are paramount.
Next, inform the healthcare provider immediately. The provider needs to be aware of the patient's decision and address any concerns or questions the patient might have. They might need to explain the risks and benefits of refusing the procedure again.
Remember, even if a patient has signed a consent form, they have the right to withdraw their consent at any time. It's our duty as nurses to advocate for their wishes and ensure their voices are heard. That's it for part 2 of Mastering NCLEX Next Gen Management of Care. You crushed it. Remember, the NCLEX is all about applying your knowledge to real-life scenarios. Think critically, trust your instincts, and always prioritize your patient's well-being. I hope these scenarios and tips have given you the confidence boost you need to rock your NCLEX. Now go out there and show them what you're made of. I believe in you. Don't forget to subscribe and hit that notification bell for more NCLEX prep videos. And be sure to leave any questions or topics you'd like me to cover in the comments below. Until next time, stay awesome.